Imagine waking up every day with a feeling of dread in the pit of your stomach, like something is wrong but you just can't figure out what. Your heart races, your mind spins, and even the simplest tasks feel overwhelming. If this sounds familiar, you're not alone. Anxiety disorders affect millions of people, turning everyday life into a constant struggle. But it doesn't have to be this way. If you find this video helpful, please like, comment, and subscribe for more content on mental health and well-being. Let's talk about the signs, symptoms, and what you can do to regain control. In this video, we'll delve deep into the world of anxiety disorders, exploring not just the symptoms, but also the underlying causes and the various types that exist. You'll learn how to identify whether your feelings are a normal part of life or something more serious. We'll share real-life stories and insights from mental health professionals to help you understand the impact of anxiety on daily living. More importantly, we'll discuss effective treatment options, practical coping strategies, and self-care tips that can empower you to take charge of your mental health. By the end of this video, you'll have the knowledge and tools to recognize anxiety disorders, not only in yourself, but also in loved ones, opening the door to support and healing. So, if you're ready to break free from the chains of anxiety and find a path toward peace, stay tuned. Your journey starts here. Waking up in the morning and before you even get out of bed, you feel a tightness in your chest. You start to worry about everything, even though nothing has happened yet. This is how anxiety can manifest for those with anxiety disorders. Recognizing the symptoms is crucial in understanding what anxiety disorders are and how they affect daily life. Take Sarah, for example. Every morning, she felt an overwhelming sense of dread, even when everything seemed fine. It wasn't just stress, it was anxiety, the kind that sticks with you all day. Sarah's experience illustrates how anxiety symptoms can interfere with day-to-day functioning. So, what exactly are the symptoms of anxiety disorders? While everyone feels anxious sometimes, before a big test or meeting someone new, anxiety disorders involve a persistent, overwhelming sense of fear or worry that can last for weeks, months, or even longer. Signs and symptoms of anxiety disorders. If you experience anxiety symptoms over a prolonged period, it may indicate an anxiety disorder. These symptoms can affect both your mental and physical health and might include excessive worry. A hallmark of many anxiety disorders, this involves constant, uncontrollable worry about everyday situations, often out of proportion to the actual circumstances. Restlessness or feeling on edge. Individuals may feel like they can't relax, as if something bad is about to happen. Difficulty concentrating. Anxiety can make it hard to focus, leading to trouble completing tasks or following conversations. Irritability. Anxiety often causes people to become easily frustrated or irritated over minor things. Muscle tension. Persistent anxiety can cause physical symptoms, like muscle tightness or aches. Fatigue. Anxiety is mentally and physically draining, even if there hasn't been much physical activity. Sleep problems. Difficulty falling asleep, staying asleep, or having restless, unsatisfying sleep is common. Anxiety can cause racing thoughts that keep you up at night. These are some common symptoms shared across various types of anxiety disorders. But different types of anxiety disorders can have their own unique symptoms as well. Symptoms of different types of anxiety disorders. Generalized anxiety disorder, or GAD, is where people experience excessive worry about various aspects of life, including work, health, and relationships. The worry is persistent and occurs on most days for at least 6 months, often leading to significant distress. Symptoms of GAD include persistent worry or anxiety about everyday matters, difficulty concentrating or finding your mind going blank, feeling restless, keyed up or on edge, muscle tension and physical discomfort, and sleep disturbances like difficulty falling or staying asleep. Panic disorder is characterized by sudden repeated panic attacks, intense episodes of fear that reach a peak within minutes. These attacks can happen unexpectedly, and the fear of having another attack can become a significant source of anxiety itself. Symptoms of panic disorder include a racing heart or palpitations, sweating, trembling or shaking, shortness of breath or a feeling of choking, chest pain or discomfort, nausea or dizziness, and fear of losing control or going crazy. The unpredictable nature of panic attacks can lead individuals to avoid places or situations where they fear an attack might occur, causing further isolation and distress. Social anxiety disorder involves an intense fear of being judged, embarrassed, or humiliated in social or performance situations. This fear is often so severe that it interferes with daily life. Symptoms of social anxiety disorder include intense fear of social situations, even casual interactions, avoidance of social events or situations where one might be the center of attention, blushing, sweating, trembling, or nausea during social interactions, fear of being judged or humiliated by others. This disorder can make even routine interactions feel overwhelming, leading to isolation and difficulty maintaining relationships. OCD is characterized by unwanted intrusive thoughts, known as obsessions, and repetitive behaviors, called compulsions, that a person feels driven to perform. These behaviors are an attempt to reduce anxiety triggered by the obsessive thoughts. Symptoms of OCD include intrusive, distressing thoughts or images, which we call obsessions. Repetitive behaviors or rituals, like hand-washing, checking, or counting, referred to as compulsions. Feeling a lack of control over these thoughts or actions, despite recognizing they are excessive. PTSD can develop after a person is exposed to a traumatic event, such as violence, accidents, or natural disasters. It often involves intense anxiety, flashbacks, and hypervigilance related to the event. Symptoms of PTSD include flashbacks or reliving the traumatic event, nightmares or disturbing dreams about the trauma, avoidance of reminders of the event, feeling on edge, hyper-aware, or in a constant state of alertness. Physical and emotional symptoms across anxiety disorders. Anxiety disorders not only affect mental well-being but can also trigger physical symptoms. These symptoms often overlap between different types of anxiety disorders and may include rapid heart rate and palpitations, shortness of breath or difficulty breathing, dizziness or feeling lightheaded, digestive issues such as nausea, diarrhea, or stomach cramps, sweating, trembling, or shaking, headaches often related to tension and stress. When to seek help. If anxiety symptoms persist over time and interfere with your daily life, relationships, or overall well-being, it's important to seek professional help. Your GP can help diagnose anxiety disorders, such as generalized anxiety disorder, based on your symptoms. If you're experiencing any of the following, it's time to consult a doctor. Persistent worry that disrupts your daily routine. Difficulty concentrating or feeling irritable most of the time. Restlessness or fatigue despite little physical exertion. Sleep disturbances that leave you feeling exhausted. Physical symptoms like muscle tension or frequent headaches. Treatment options. Anxiety disorders are treatable, and there are several options to manage and reduce symptoms, including therapy. Cognitive behavioral therapy is a common and effective treatment for anxiety disorders. It helps individuals change negative thought patterns and behaviors associated with anxiety. Medication, anti-anxiety medications or antidepressants may be prescribed to help manage the chemical imbalances associated with anxiety. Self-care strategies. Regular physical activity, mindfulness, breathing exercises, and relaxation techniques can help reduce anxiety symptoms. Lifestyle changes. Managing stress through healthy eating, proper sleep, and reducing caffeine and alcohol intake can improve symptoms. Understanding anxiety disorders and recognizing their symptoms is the first step toward getting help and finding relief. In the next section, we'll explore more in-depth treatment strategies and self-care practices for managing anxiety. Remember, while anxiety can feel overwhelming, treatment can make a huge difference. If you found this video helpful, please subscribe, like, and share to spread awareness about anxiety disorders.